Manyonga. So I'm going to teach you about pharmacology of the drug aspirin. So those students who are more interested in research, I think this is the right video for you to watch, since aspirin shows to be promising in the nearby future. So there are different brand names of aspirin. Here I only mention a few, which are the most common one: Ninoprin, Aspirin, Halprin, and Bayer. Then there are two types: non-prescription and these non-precision and precision aspirin. In non-precision, these are tablets or medication one takes when he feels pain. We know he or she feels pain, for example, headache. Then precision aspirin, these are prescribed by the doctor and they need the patient to be strongly supervised by the doctor. Then the pharmacology, it is composed of a benzene ring with an acetyl group attached to central carbon atom. It acts as an anti-inflammatory, analgesic, and antipyretic. So its pharmacological properties make it cornerstone of radiology treatment. So let me explain a little bit about its anti-inflammatory, analgesic, and antipyretic. So, as it is anti-inflammatory, it inhibits prostaglandins, which are hormones that cause inflammation. For example, it inhibits cyclooxygenase enzymes, which help reduce inflammation and fever, thereby minimizing risk of clotting, thereby improving image contrast. So, mechanism of action. This is how like the drug helps to improve in imaging. So aspirin helps reduce amount of blood flow to area being imaged. Also helps reduce inflammation due to its anti-inflammatory properties, as we said earlier. Imaging mechanism by increasing contrast between healthy and diseased tissue. Pain imaging procedures are also reduced. This improves quality and clarity of images. So it's patient friendly since pain imaging procedures are also removed. So the patient won't shake during the procedure. So let me expagorate a little bit about the mechanism. Aspirin helps improve MRI images by reducing blood flow and decreasing the amount of time it takes for the image to be captured. This is because aspirin reduces inflammation, making it easier for blood vessels to relax, which allows for more efficient flow of blood. It prevents aggregating, which can sometimes interfere with image quality by producing unwanted artifacts. As we all know that if a tissue is diseased, we can see that through ultrasound more blood will be flowing to that tissue. So that's inflammation. So it is reduced, and also blood aggregating, blood clotting, it's also reduced. So blood will flow efficiently, thereby improving the quality of images. For example, here I give you a picture of neuroimaging. The one is taking aspirin and there's a better view, and the other isn't taking the aspirin. So the route of administration, it's easy, goes like this. Ensure the person has no allergy to aspirin. Yeah, that is the first thing you need to make sure, that the patient is not allergic to aspirin. Then patient takes aspirin tablet orally before MRI scan. Monitor patient for signs of bleeding or bruising. Monitor for any adverse reactions to aspirin. After MRI scan, patient can take another dose of aspirin depending on the medical history. So although it is promising, it has also side effects, which includes heartburn, headache, nausea, vomiting, bleeding stomach, or ulcers. It also has relevant examples where it's used in radiology, except in the MRI. For example, firstly, prescribed aspirin relieves symptoms of rheumatoid arthritis, which is the swelling of the lining joints, then osteoarthritis, which is the breaking down of the lining joints. The non-precision aspirin eradicates fever, toothaches, and headaches, reduces ischemia, strokes, reduces heart attacks, reduces death. Then someone will be like, how can aspirin say it reduces death? Just imagine one we say is just taken aspirin tablet and we are saying that his risk of dying is going to be reduced. So I said it reduces death since it reduces heart attacks, Since heart attacks can cause sudden death, then it reduces death since heart attacks are reduced. Thank you. Don't forget to subscribe and hit that like button.